Hmm.
Okay, good evening. This is Brother Wolf, and this is HS 285. And tonight we have this is Group 6, talking about advocacy groups. Um, Keep in mind, everybody, that Group 5 will present tomorrow night on professional groups. And these two presentations are done during the same week just to kind of contrast the difference between a professional group and an advocacy group. And if you remember, when the group presented on the AMA. If you don't recall that presentation, you might want to go back and watch the recording. But I believe I talked about kind of three buckets. As we go through the semester, you'll learn about a lot of different kind of groups, like the American Hospital Association or the American Medical Association, and these different organizations. Some are going to be considered advocacy groups. Some are going to be considered professional organizations, and some are considered both. So it's kind of those three categories that all of our groups should fall into. And the AMA, or the American Medical Association, is one of those groups that falls into both. So if you get a test question, it's one of those three choices of advocacy group only, professional group only, or both. Um, and just with that introduction, I'm going to turn the time over to the group, and Bridget's going to start, I believe. Whenever you're ready, feel free to start.
Okay. All right. So our presentation is about advocacy groups, and advocacy, according to the Webster Dictionary, it means the act or process of supporting a cause or proposal, the act or process of advocating something. So advocacy, will usually mean to influence public opinion or policy to move something that they, are supporting or believing in. Um, an advocacy organization is similar to the definition of advocacy in that it is a body of people that are working together towards a common cause that they feel extremely strongly about. Like I said previously, advocacy, they influence public policy or opinion, and they have an important role um, in the development of political systems or social systems. Examples of this could be an industry or an item of legislation. Some advocacy groups could be lobbyists or campaign groups, interest groups, etc. All right, and then a professional group to kind of contrast an advocacy group is a professional organization that is a body of people with a common cause of furthering our particular profession and helping those that are engaged in this particular profession maintain standards and help maintain the public interest. I think that they're usually nonprofit organizations, furthering to session or help those that are interested individuals in this particular profession and engaging it to the public interest. Not all of them, but some, and more importantly, some of them. So the first one is educating the public with factual information. Um, they can educate the public with pamphlets or, you know, meetings and giving them the information, speaking in behalf of the public, and different groups like that. They problem solve, they come together and decide how they can tackle a problem, what things would be more effective. They maintain ethics within the advocacy group. There's a level of respect and appreciation towards each other, to become a membership of an advocacy, a member, sorry, of an advocacy group. Of advocacy groups are usually lobbyists and lawyers. Lobbyists are those that speak in behalf of the particular organization and are able to persuade policymakers to make policy changes towards their respective organizations. Lawyers are there for the legal representation of the advocacy group. So, you know, with lobbyists, you know, the government, the lobbyists go to a big meeting and try and advocate their specific organization that they are speaking in behalf of and persuade those policymakers to vote in favor of something that is beneficial to their particular organization. They go with a plan to this, you know, big meeting and hope to gain acceptance or, you know, in favor of their organization and whatever policy that they're trying to get accepted. Roles and memberships within professional organization. The roles are representing interests of industry, sharing new ideas that set standards within the workplace, set a mission for the professional organization, promoting information to the public about the industry, networking through holding conferences, support systems, and again, I reiterate, holding conferences and seminars. To become a member of a professional organization, it seems as long as you pay an annual fee, anyone can join a professional organization due to the benefits that many professional organizations offers to its members. You know, around the world, there are a variety of professional organizations that people can join as long as they pay an annual fee. You know, there's a lot of professional organizations that you can join, like example, there's an organization called the National Collegiate Scholars of America, and you can join that professional organization as long as you pay, you know, a $50 fee, and that could go on your resume or something. So that is the roles and membership of a professional organization. Brittany?
All right, and some of the principal advocacy groups, I've got a couple listed here. The first one is the Physicians for a National Public Health Program, or PNHP. They support a single-payer national health insurance, which is a system where a single public or quasi-public agencies organize health financing, but delivery of care remains largely private. Under the single-payer system, all Americans would be covered for all medically necessary services like the doctor, the hospital, preventative, long-term care, mental health, reproductive health care, dental, vision, prescription drug, and medical supply costs. Something I thought was interesting was this is not like socialized medicine where it's the government that's controlling. This is more of a people that controls the things that are happening. The next one is Physicians Committee for Responsible Medicine, or PCRM, and they promote preventative medicine, conducts clinical research, and encourages higher standards for ethics and effectiveness in medical research. Some of the benefits were that they had employee-sponsored health insurance coverage with low contributions. They had 4 weeks of paid time off, and the 13 national holidays are paid as well. They had paid gym discounts and free weekly lunchtime and yoga sessions. Financial benefits, they had retirement savings plans and long-term disability and income protection insurance.
Brother Wolf, do you just want me to go on?
Um, yeah, go ahead.
Okay. So, well, it looks like there's specific principal advocacy groups. There's the Doctors Without Borders for the United States of America. It's an international independent medical humanitarian organization that delivers emergency aid to people affected by armed conflict, epidemics, natural or man-made disasters, or exclusion from healthcare in more than 70 countries. The benefits of this are paid 25 days vacation, medical, disability, and life insurance coverage, letter of support for student loan deferment, required visas and work permits, reimbursement of mission-specific vaccinations, accommodation and transportation in New York City and Europe for briefings and debriefings, and you also receive a monthly salary of $1,731 and raises based on experience. I'm sure a lot of you have heard about Doctors Without Borders, and it's, where medical or even dental people go and, they give aid to third world countries and stuff like that. The Families USA is dedicated to the achievement of high quality and affordable health care for all Americans. Okay. The next slide is the principal professional groups. There is the American Association of Healthcare Administrative Management, and that is the AAHAM. Their mission is to provide education, certification, networking, and advocacy for healthcare revenue cycle professionals. The benefits are, they get to go to a seminar, they have meetings, they produce discounts, the affinity discounts on credit cards, hotels, and rental cars, subscription to Legislative Currents, and that's 8 times a year, subscription to the Journal of Healthcare Administrative Management, national news, weekly newsletters and updates, membership directories, job bank assistance and job posting and searching, and eligibility for the certification designations. And as you can see, a lot of the have a lot of great benefits, and they also provide a mission statement with their professional group. The next one is the Association for Healthcare Administration Professionals, and that is the AHCAP. The benefits of this is they can print and have online resources. They have lots of networking opportunities, which is super beneficial because I think if you want to go anywhere, you have to have a really good networking system. They have job searching tools, they have discounts to education events and tuition discounts, and I think a lot of professional groups offer a lot of discounts to those that are members. The next is another principal professional group is the American Medical Association, and as you know, that's the AMA. This is primarily for physicians, and it helps build knowledge and keep it current. They have full access to AMA publications. You can share your perspective and make a difference, get involved in the work that matters to your profession, gain expert support to help you with your practice and career, and enjoy special savings on insurance, financial services, and medical supplies, travel, etc. The next professional group is the American Nursing Association, and it is for all nurses of all types. It also, the benefits of this is they give professional liability insurance, auto insurance coverage, long-term care insurance, and term life insurance coverage, and they give financial planning opportunities, newsletters, local networking, representation in the state house on critical issues. And then, the AMA helps physicians help patients by uniting physicians nationwide. So these are both, beneficial groups for those that are in the medical field and are physicians and nurses. There is the next professional group is called the American Association of Nurse Practitioners, and these are only for nurse practitioners. They have access to 150 continuing education activities. They also receive discounts on certification programs. They have free access and registration for seminars, and they also get a free subscription to some journals that are peer-reviewed. And those can include the Journal of Nurse Practitioners, Prescribers Letters, VIP Member Services, and Health Monitor magazines. And I'm sure that those magazines would be extremely interesting if you were a nurse practitioner. The next professional group is the American Association of Medical Assistants. The information of medical assistants, and I think she meant to put CNAs and how to prepare for tests. You know, they get to fight for the right to practice as medical assistants, answer job-related legal questions, stay on top of federal and state laws regarding medical assisting practice, and get credentials verified, help resume and build credibility. They continue education discounts. The membership is cheap, and they get discounts on conference registration, volunteer opportunities, and special rates for personal accident and long-term care. Some other professional groups are as follows: the American Board of Cardiovascular Perfusion. They are the operators of heart-lung machines during open heart surgery. We have the American Society of Echocardiography, the Society of Medical Diagnostic Sonography, American Physical Therapy Association, the International Society of Radiographers and Radiological Technicians. We also have the International Medical Interpreters Association and the American Pharmaceutical Association. So there's organizations that have both advocacy and professional organizations, and one of them is the Alliance for Professional Health Advocates. This group helps members start or grow their patient advocacy business. You can join whenever, and the cost can vary from $49 to $279, depending on what type of membership they want. Anyone who is a private, independent health or patient advocate can join. They have lots of activities like conference calls, weekly emails, and forums to keep people motivated. They also help support marketing, legal needs, networking, and public directories. And I'm sure if you want to learn more about this particular organization, we've left a contact number and an email for you to ask questions to. The next organization that has both is the National Health Association of Health Advocacy Consultants. This is a nonprofit organization that offers consumer education and represents healthcare advocates. They also help support online medical and advocacy library and code of ethics and best practices. You can join if you're interested in the field of healthcare advocacy. To join, it costs $175 annually to be a member, and you also have to contact this specific email if you're interested about that. The last organization that has both is the Professional Patient Advocate Institute. They help advocate education and networking, which is super beneficial. Like I said, after you graduate, networking is something that'll help you get into jobs. It's really, really beneficial. They help support 12 issues of Case and Point magazine, weekly newsletters, registration for the annual Patient Advocate Conference, and an invitation to monthly patient advocate networking calls. And just like the others, you have an annual fee, which for this organization can cost $249 for a year if you have 3 to 10 employees, or $199 a year if you have 11 or more employees, or if you don't have that many, it's going to be $129 per employee. And for more information about this, you can contact them at that specific webpage. So yeah, and that is the end of our slides. So I hope you all enjoyed it.
Thank you, Bridget. I appreciate you filling in. I know we had some technical difficulties, but don't worry about that. I appreciate you doing the best you could. So, excellent job. You guys have listed a lot of different kinds of organizations. I want to be able to highlight a few so that you, as well as your classmates who are going to listen to the recording, don't feel like you have to memorize all of these, right? But I do want to give you some key ones that you should learn, and you guys hit on a lot of those. So you talked about the AMA, and a lot of people ask me, is the AMA professional or is it an advocacy group? For this class, we're going to call it both. So it's professional because, as you guys stated, any society that's considered a professional society is one that promotes that profession. So you kind of have to have an organization that's promoting the profession of an individual, right? So a physician, that's a profession. A hospital, that's not a profession. So to contrast the AMA with the AHA, the American Hospital Association, it's not a profession to be a hospital. So the American Hospital Association is a group that is strictly advocacy. It's advocating for the hospital industry. And as you guys pointed out, I think, Bridget, early in your slides, you mentioned kind of the legislative lobbying component. That's usually a good clue that something has an advocacy component to it. But some professional societies that are strictly just professional, could be doing some lobbying. So it's not an absolute rule, but it's a general rule. So the AMA is going to be considered both because it does try to advance the profession of being a physician or a medical doctor, but they also, because they're such a powerful professional organization, they advocate for causes. So if you go back to Group 1's presentation and that recording or their slides, you'll see that some of the topics, or even if you just go to the AMA's website, they advocate for things like seatbelt use or no smoking, and they advocate for trying to have certain restrictions and legislation around smoking ads, especially around children or young adults and those sorts of things. So they're advocating for health, not necessarily for their profession, and so that makes them both. The other one that you listed was the ANA, and this will probably come up on some tests. The American Nurses Association, and for this class, we're going to call that both. So yes, it's professional because that's kind of how it starts, and that's probably the main focus of the American Nurses Association is the professional advancement of nurses and continuing education and keeping the profession sharp and crisp and respectable. But the ANA also has some advocacy efforts as well. So we're going to call that both. Now, some that are just advocacy are going to be the AHA, the American Hospital Association, which I mentioned, the FAH, the Federation of American Hospitals. And do you guys remember the difference between those two? So they both represent hospital groups, but one represents a certain kind of hospital group.
A nonprofit?
Yeah, which one's the nonprofit?
Sorry, what were the Federation of American Hospitals?
That one's the for-profit.
Yeah, that's a for-profit.
Exactly, and the AHA is the
not-for-profit.
Exactly, that represents the not-for-profit hospital industry. So those two are important groups to know, and they are strictly advocacy. So they're not professional at all, because they don't really represent a profession. Now they represent an entity, a hospital, but that's not really a profession. So those are important to know. But like the one that I don't think it was on one of your slides, but it's really more of a professional organization. So groups 5 will probably touch on this a little bit more. And I don't want to steal all their thunder, but one of the American College of Healthcare Executives, ACHE. That's one you'll probably want to know. That's a professional society only. Okay. HFMA, Healthcare Financial Management Association. That's professional. That's really a professional society. So, and I don't want to get too much into the professional societies. I wanted to highlight some that are both. You guys mentioned a lot of good ones too. I just didn't want you to feel like you or your classmates have to memorize all the ones that you talked about. I wanted to highlight a few of those that I just did. So excellent job. Let me ask if you guys have any last minute comments or questions.
No, I think
I don't.
No.
Okay, well, good job. Thank you for your work on this. I think I saw that you already posted the slides. If you did, I appreciate you doing that. I think it was your group.
Yeah, I posted them this morning.
Okay, thank you for doing that. And just if you would, kind of watch that that discussion board throughout the week. See if your classmates have any questions about your presentation. Otherwise, there's no other requirements for anyone to post on that. It's more of a place for you to post your slides and for classmates to ask you questions. So excellent work.
Thank you.
Thank you.
Have a great night.
Okay, you too. See ya.
Bye-bye.